We see the research that we see, the endocannabinoid system, which all vertebrate animals have one. That means all humans, horses, dogs, cats. We when we respond better to the therapeutic benefits of cannabis, of the plant, when it's full spectrum. Not when we're just using one compound. The plant is made over 700 compounds. So when we take away those other 600 and some change compounds, we don't get a full effect, the full therapeutic effects of the plant.
Hi, everyone, and welcome back to Harmonia Podcast. We are joined here today by the fabulous Nicole Buffong, who is an American, well, US patient advocate and medical cannabis patient, obviously. Hi, Nicole.
Hello, Berta. Thank you so much for having me.
No, Nicole, thank you so much for coming onto the show and talking about your experience. But before we go into that, let me just hand over to you to do like a proper introduction of yourself.
Okay, yeah, sure. My name is Nicole Buffong. I am a plant medicine advocate. I have been using plants as medicine since I got my diagnosis of HIV and kidney disease back in 2017. I moved from an illegal state, or a state where I did not have safe access to cannabis as medicine, from Georgia to Nevada in 2019, following that diagnosis, and have been working as an advocate with a nonprofit called Minorities for Medical Marijuana, as well as involved and sitting on the board of other organizations like the Chamber of Cannabis, which is in Nevada, and Association of Cannabis Health Equity and Medicine, another national nonprofit.
Wow, like honestly, the work that she does is absolutely fantastic, and I'm just so blessed to have you on here to share your experience. Would you tell us a little bit more about, I guess, how medical cannabis helped you and what sort of inspired you to speak up as a patient advocate?
Yeah, so I have to attribute that that journey to my father, a lot to my father. My father was a Rasta. He passed away in 2016. I'm sorry, 2006. And passed away in a car accident. So that type of he was on his him and my sister were on their way to my 25th birthday. They both passed away in that car accident. But his teachings about natural medicine has always stuck with me. It comes from him learning from the Rastas in his home country of Dominica how to heal his prostate cancer using noni juice and other plants, including cannabis. And so that's kind of how it started. And when he started growing his locks, just the basic foundation of what their belief system is as a Rastafari, understanding what Ito food is, and then knowing who Dr. Sebi is and understanding the power of using your food as medicine. And so that's how my journey began. And that was one of the main reasons I left Georgia, was because I needed access to cannabis as medicine and I wasn't able to get it safely in Georgia. So I moved to a legal state. And when you think about how cannabis is used and how it's historically been used within the community, HIV and AIDS community, the legal movement towards legalizing cannabis in this country started with the AIDS epidemic in the 80s. In the late 80s, the caretakers in places like California, where the AIDS epidemic had just gone through the LGBTQ community there, and the caregivers that were taking care of these people, because the disease was so new, there were doctors and nurses in hospitals that wouldn't take care of these patients, wouldn't touch these patients. A lot of them died in isolation. But what they noticed, what patient advocates noticed, was how impactful cannabis was in helping them manage the symptoms of this new disease. And so that's what really pushed the legal movement. Um, Harry Milk in San Francisco just saw how the disease was ravaging his own community, and became an advocate for legalizing. Dennis Perone, who we know as one of the lead advocates within the movement, was also came out of that community. So understanding that knowledge, knowing the history around the plant, I knew that there was going to be a way that I could heal my body, that I can reverse the disease, by sticking to a regimen that would require plants as medicine, using plants as my food, also, and using different herbs to help manage the pain, manage the symptoms of the condition. And so that's really how it all started. I became an advocate because I had to be my own advocate. I had to educate myself. I had to read research and read studies that my own doctors did not know about. And then so it was a natural fit for me to become an advocate. And then getting involved with Minorities for Medical Marijuana helped me to learn really, truly how to be an advocate, how to be a lobbyist. And so that's just how the journey began and how it's been going the last 7 years.
Absolutely fantastic. One of the things that I would like to know, because I am going to be honest and say that I am very ignorant when it comes to the benefits of medical cannabis and HIV. Can you, I guess, elaborate on that a little bit more, please?
Yeah, sure, sure. So, what most people don't understand, and I didn't understand until I had to start taking medication, and knowing the different layers and levels of medication, where the medication goes and where it doesn't go. So, there was a recent study that came out of International University of Florida. I'm sorry, that's Florida International University. And so the research came out about 2 months ago that proved that CBD, um, pass the blood brain barrier. Most HIV medications do not pass the blood brain barrier. And this research came out of pooling a bunch of HIV patients, and recognizing a similar conditions or similar symptoms of the disease, which would be brain fog and memory loss. And what they recognized is that those individuals were having a lot of the HIV virus accumulate in their brains because the medication, you might be undetectable. In our community, undetectable means that you cannot find a drop of the virus, any of the virus in a drop of your blood. So when I got diagnosed in 2017, my viral load, which is the number that they're monitoring how much of the virus is in your body, my viral load was over 400,000. And at the time, they explained to me that in order to become undetectable status, that number had to be below 40, which seemed impossible at the time. But within 6 months, I was undetectable, staying on the medication. The medication is good. It works. It works better than the medications that we had before for HIV, but it's not supposed to be a long term solution. It's a synthetic drug. It causes a list of side effects. They've attributed bone density loss to it, kidney failure, liver disease, all of these things from long term use on these different medications. And so, in that research, you understand that these medications do not pass the blood brain barrier. So, they do not get into the brain where the HIV virus can accumulate. And that's how it keeps cycling out through the body. And so, this particular research proved that CBD does pass the blood brain barrier, and its anti inflammatory properties and antiviral properties, along with the other compounds in the plant, help to eliminate the HIV virus in the brain, stop it from accumulating. So that's just one way. I also use it to manage pain. I suffer from fibroids as well, and so monthly, my menstrual pain is very painful. And so instead of popping Tylenols, which is what I used to do, I just use the plant. I rub it on my body. I rub it on my pelvic area. A salve. I also use it sublingually. I'm vaporizing with it. All the products that I choose to use at this point, because I'm knowledgeable and understand how important it is to know your grower. So I'm using flower that is organically grown, no pesticides, no chemicals used in any step of the phase of processing the plant. And I'm also using the most clean versions of concentrate that I can get. Also processed from clean organic plants, flowers, and then used without chemicals. So solventless concentrates are the only kind that I consume. No edibles, nothing with any additives or anything like that. Everything is just pure plant. And so I'm very particular about where I get my product from, where I get my medicine from. And that helps to make sure that I'm also educating people about how important that is, how important it is to know your grower, know where you're getting your medicine from, just like your food. I'm I use my food as medicine. So I don't shop at the grocery store. I choose to shop at farmers markets that I find around the country when I'm traveling, especially. And which means that I eat food that's in season. I eat fruits and vegetables that are in season. I'm very particular. I only eat grapes when I can find seeded grapes. I only eat watermelon when it's watermelon season. Can't wait for watermelon season to come back. But these are the kind of things that you have to adjust in your lifestyle. If you choose to use your food as medicine, it's an adjustment because you have to be very intentional, conscious of what you're putting in your body. So yes, that's how I use the plant specifically for my specific condition and my kidney disease. I'm sorry, my kidney disease is also creates a lot of inflammation in the body. The virus attacks these. So the food that I'm putting in my body also helps me my kidneys from getting worse. But also the products that I'm using, CBD, the full spectrum products that I'm using, also help with the inflammation in the body and helps reduce the kidney flare up.
Okay, I have so many questions. So, well, it's not really questions. It's just to sort of clarify for patients that are a bit more cannabis naive. So, when you say full spectrum, would you like to elaborate on that a little bit, please?
Yeah, sure, sure. So cannabis, a lot of products that we see here in the U.S. Since the 2018 Hemp Act passed in the Farm Bill, has been an explosion of CBD products everywhere. Everywhere you look, they're in the gas station, on Amazon. They're just available everywhere, in your local coffee shop. But what we have to understand is a lot of these products that are being put out onto the market, especially here in the United States, are not going through the rigorous products like what our food even goes through. So because at the time that the Hemp Act was passed, and what we saw was essentially a descheduling of CBD. They kept anything with THC higher than 0.3% in that Schedule 1 category, but it's almost like they descheduled CBD and said if it has CBD, then it doesn't have to be sold in a dispensary. It doesn't have to go through, you don't have to prove that there's a COA on it even. It's unfortunate. So you get a lot of products that you don't know where they're coming from. You don't know if even what's on the label is actually in it. And a lot of times it's an isolate. So an isolate means that they pulled just CBD out of the plant. They isolated it out, created a compound, whether it's a powder or some liquid, even, and then put it into your product, and whatever that product may be, whether it's a gummy or if it's a tincture or even vaporizers. Now they have so whatever that may be, it just has CBD in it. And what we see, the research that we see, the endocannabinoid system, which all vertebrate animals have one. That means all humans, horses, dogs, cats. We when we respond better to the therapeutic benefits of cannabis, of the plant, when it's full spectrum. Not when we're just using one compound. The plant is made over 700 compounds. So when we take away those other 600 and some change compounds, we don't get a full effect, the full therapeutic effects of the plant. And it's called, some people call it the entourage effect, some people call it the ensemble effect. But essentially, it means that when you use the whole plant, the way that God, divine energy created it, then that is where you get the most benefit from it. And so that's the difference. Full spectrum means that it's got all of the full plant in it, all of the compounds, all your flavonoids, terpenes, and cannabinoids. And then broad spectrum is another product category that they have now, which is all of the compounds except THC, because there are some people who need the medicine, but they can't have THC in their system. And so what they've realized is they can create the plant without the THC, and create a full spectrum, what they call broad spectrum medication, and it still has the therapeutic benefits. It just doesn't have THC. Because here in the United States, you fail a drug test if you test positive for THC. There are no tests for CBD. So when they're testing you for whether or not you've consumed cannabis, the only test they're testing for is whether you have THC in your system, not how long ago you smoked it, not how much you have in your system, just whether it's in there or not. Then you fail the drug test.
And you know what? It's really sad. Yeah. I mean, it's the same here. So that's how we test it as well. But it's just really sad because if you think about it, especially when it comes to THC, somebody could have smoked a joint 3 weeks ago and it would still be in their system. And what if they were on holidays?
And they will fail a drug test. Yes, cannabis THC stays in your system, in your blood and urine for more than 30 days. If you're testing hair, at least 10 years. So it just depends, what kind of test they're going to be doing. But yes, essentially, I don't think there is a test. I think they have some DNA tests maybe that you can do, but there are no tests that I know of, especially for jobs or whatnot, that test for anything else besides THC. They're just looking for the trace amount of it, and that means you failed the test.
Anyways.
It is a shame. It is because the people making these decisions don't understand the benefit, the therapeutic and medicinal benefits of using this plant, and they just assume that anybody that has THC in their system are some kind of criminal, which is just ludicrous, right?
Yeah, no, I mean it's pretty much the same here. I mean these days they are starting to recognize medical cannabis a bit more and more and more. Recognizing and accepting are two different things, however. But I'm not gonna go into that. I really want to focus on more of the education while I have you on here. So another thing that you mentioned that I think it's really, really important for people to understand is the endocannabinoid system and how that works with the blood-brain barrier. Um,
Yeah. So the endocannabinoid system is an intricate, vital system in our bodies. I recommend anyone who is new to this space and has not heard of the endocannabinoid system, also known as the ECS, to Google Dr. Rachel Knox TED Talk. Rachel Knox, Knox spelled Knox. Her TED Talk on the endocannabinoid system is brilliant. It's about 15 minutes long, and she breaks it down in a way that anybody can understand, any age, any demographic. It's truly brilliant. So I recommend looking that up. But if I can summarize, essentially, the endocannabinoid system is made up of receptors and cells and or compounds. And these receptors and compounds communicate with each other, and they also communicate with every other system in the body. And so something that the Knox doctors, it's a family of endocannabinologists, have coined the term the endocannabdome, which means it dominates over the rest of our systems because it's in charge of creating homeostasis in our bodies. That's its job. The immune system's job is to fight off viruses, to fight off bacteria, to make sure that your body is functioning healthy. The cardiovascular system's job is to pump blood through your body to make sure that you're getting all the blood you need to all your organs. Every system has its job, but the job of the endocannabinoid system is to create homeostasis. That means balance throughout the body, and it does that by having these compounds and these receptors talk to each other, and they float all throughout the body. Well, these compounds, like CBD, like THC, mimic inner cannabinoids that our bodies make. And so these cannabinoids, THC and like CBD, attach to different receptors. And those receptors, that will tell the body it's time to be happy, it's time to eat, it's time to sleep. These are the kind of things that create that balance in your body. And so that's how the plant responds to this system. And so not everybody's system is the same. Everyone has one, but not everyone's is the same. Not everybody's chemical balance of that system is made up in the same way. And so that's why cannabis is not the end all be all for everyone. It's just not. It is a plant that helps, and it is a plant that can help many people. It shouldn't be illegal though, and it shouldn't be criminalized. But it doesn't mean that it is the answer for everyone. And so I hope people understand that you understanding your endocannabinoid system and what other chemicals, because cannabinoids are specific to the cannabis plant, but also cannabinoids and terpenes can be found in other plants. So just understanding how your endocannabinoid system works, how it responds to cannabis, because some people that I know personally that I've helped through their healing journey, use cannabis in different ways. Some people can tolerate high THC, some people cannot. I have a friend that has been diagnosed with schizophrenia. And when he was trying to use cannabis, smoke weed to help with the anxiety, it just didn't respond well to it. But when we found him a formula that was high in CBD, low in THC, that he was able to come off of one of his anxiety medications utilizing that formula. And so it's important that you are communicating with someone who's knowledgeable. There are different types of consultants out there, doctors that are specializing in this area. There are more and more that are coming on board. There might be a little bit harder to find, more challenging, but we do have a strong community out there. And truly, just reach out because The more you start talking about it, the more you normalize it. We need to stop bringing shame and stigma around how we use plants as medicine. There's no shame in wanting to use psilocybin or antidepressants. Like there's no shame in wanting to choose a plant over a pharmaceutical drug if that's what your choice is. As long as you're not harming yourself or anyone else, you should have the right to be able to choose. But I definitely say make sure that you educate yourself. Make sure that you are arming yourself with the resources that you need to be knowledgeable. If that's the route that you want to go down, then definitely make sure that you go down that rabbit hole of information, because there's a lot out there, and there's a lot more than there was 20 years ago, 30 years ago. We're getting to a point where information is at your fingertips, and so there's a way for you to do proper research. You don't need to have a degree in order to do the proper research nowadays. You just need to know when a site is. You need to know the things to look for when a site is fake versus when it's a real site. And there's ways to do that. Just check the sources. Make sure that don't go down and you can't find the sources for the information, because usually there's some research papers that are back up the information and facts that are given.
Just wow, fantastic. No, but you know what? You mentioned two things that I definitely want to just touch on. The first one is that not everyone can tolerate THC, and I think I have said this before on this podcast, and I just really like to reiterate that for people is that THC doesn't always mean that, or the volume of THC doesn't always mean that this medication is much better than another medication. So, someone like myself, I've got a very sensitive nervous system. You give me any kind of THC and I'm feeling it. And so, I generally tend to prefer a much lower THC strain and much more CBD. So, something more balanced works for me. However, there's other people that are out there that would try it and it would do absolutely nothing. And I mean, for the daytime, at night, unfortunately, the pain creeps back up on you because you've had a long day and everything. I need something stronger. But at that point, I don't care because I'm not working or doing anything. So exactly. I'm just like going to sleep. And even then, you wake up in the middle of the night because the pain wakes you up at night because, the medication only stays so long in your system before you're woken up by the pain. And so, you do need something more stronger in the evenings and at night than I feel than I do during the day because this goes back to again now what you were saying before is that medical cannabis should not be your be all and end all. I constantly advocate that medical cannabis is part of your care, which means there are other stuff that you need to do. And one of the most important things that you need to do is diet. Diet, diet, diet. It all comes down to diet. Oh, do not even get me started.
Diet and move your body. Like, don't forget to exercise. Like, we can't just think we're gonna eat, grass and carrots and everything's gonna be okay. No. The balance of moving your body is vital to being able to stay healthy. Like,
And do you know what I find the most annoying, right? So people who get diagnosed with like a chronic illness, yeah, often we are told, oh, don't, especially if it's pain related, oh, don't exercise too much. You're going to trigger the pain. You're going to trigger the pain. Actually, that is the worst piece of advice that can be given to you. And I don't know why doctors continue to give this advice. If you go online, you will see, oh, limit exercise. No, 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 no. Like, change the exercise you were doing.
yeah, yeah, right. Try a different exercise. Yoga is exercise.
I've grown up as I come from a very athletic family, right? And my favorite sport, believe it or not, is kickboxing. And I used to do a lot of kickboxing and MMA and lifting weights. I love lifting weights and whatever. Yeah, but the point I'm trying to make is obviously once the pain got worse and worse and worse, I did try to lift weights again, and I ended up giving myself a hairline fracture. So I was advised, you can't do that, yeah. And I was like, okay, fine, I need to change my tactics around. Yoga was something I used to do just to kind of like help stretch and help relax with your mental health. It's something I've incorporated into my day to day life now. I must do yoga. So when you wake up in the morning and you take your vitamins, I have my ashwagandha to help boost me. I have my morning meds, and then I have my and then I do yoga. And that usually helps me to feel okay up until about 4 p.m. I might need to, like, stretch a bit here here and there. And sometimes I feel like, oh, I'm in a lot of pain. I'll go and like I'll get ginger root and boil that because it's natural anti-inflammatory. Like we shouldn't always rely on our medication, because when you do that, I mean, A, psychological dependency, but B, you're not doing everything that you can to take care of your health. The medication is a symptom reliever, and not like not curative in a sense, if you get what I'm trying to say. Yeah.
No, absolutely, absolutely, and that's even more important when we talk about plant medicine like psychedelics, right? It is the experience of going through and using powerful psychedelics. It has is a very delicate balance. You have to make sure that you're in the right environment, in the right state of mind, and you want to have someone around you that can help you through that experience, especially if it might be your first time or even second time. If you're not, a novice, it's truly an amazing and powerful medication, but used in the wrong way, abused in the wrong way, just like anything else, can have some pretty traumatic, results. And so you got to be careful, understanding that it is not just one thing. And I tell people that all the time. You have that psychedelic experience, but then what is the work that you're doing after that to help you through whatever it is that came up through that experience? Because that's what it does. But it's not just that. There's the work after that you have to continue to do to really heal, to really get through whatever it is you need to get through. And yeah, I use cannabis is just one of the many plants in my toolbox. Like I said, my food is my medicine. That is probably the most important tool that I use daily. More than cannabis, I would say. Cannabis is a symptom reliever, and it is a symptom assistant and manager, one of many. But like, yeah, I drink ginger tea all day long. Water and ginger tea is the only thing I drink. I don't drink sodas. I don't drink, teas, and or unless I'm making it myself. Like, I'm very particular about what I'm putting in my body, because everything that I'm putting in my body is for a reason. And so I'm very intentional with that.
And so, just to sort of like round things up a bit, yeah, for patients, like, because I think we kind of like spoke a lot about what are the different benefits of using a holistic model. And so I really, really want to just put that out there for current existing patients, that you can actually feel so much better if you actually have a holistic approach. And this isn't us just saying stuff like, and this applies to any medication that you're using. Holistic approach is what is needed. But what about for patients, Nicole? What would be your advice for cannabis naive patients that are considering, but are, I guess, because of stigma or whatever reason, are very, very nervous about trying a psychoactive substance?
I would say find your tribe. That is the best advice I could give. It's what worked for me. I got diagnosed in 2017 in March. Actually, this last week was my 7th year anniversary of my learning about my condition. And it brings up a lot of memories, and a flood of emotions, because when I got diagnosed, I there was a lot of uncertainty, a lot of shame, a lot of guilt. It's not like I didn't know better. I know I got HIV from having unprotected sex, and so it's not like I didn't know what a condom was. Just all of those things and feelings and emotions, and then how I'm going to explain it to my friends and family. Well, it took me a full year, before I went public with my diagnosis, because that was me. That's how I needed to manage to absorb. 7 years ago on my radio show, I talked about it. I never thought that I would be talking about my HIV condition on a FM talk show, 7 years later. But it took me some time to get to that point. And the best advice I can give you is don't be ashamed. Like, speak up. There are groups and groups of people out there that are living through the same thing that you're living through, and they're just waiting for you to come find them so that you all can heal together. And so I'm shamelessly, I'm in plugging my own show, the Heal Out Loud show. It is, my gift, my contribution to this community, to this journey that I'm on. You all don't be ashamed of wanting to ask questions about how to use plants as medicine. I'm sure more people are asking nowadays because more people have access to it. More these conversations are happening on a legislative level, in every country. And so if you have questions, go out there and find your tribe. Minorities for Medical Marijuana became my tribe. They are my tribe. We are a 501c3 located in the United States, but the projects that I'm working on globally include Association of Cannabis Health Equity and Medicine, Chem Global Alliance. So there are communities out there that are just waiting for you. And so I would say, step outside of your own shame and fear of wanting to use plants as medicine and just start asking questions. But find your tribe. And it's important to do that because you want to be in a place that you're comfortable asking those questions. And M for MM was that place for me. And Chem could be that place for you, especially because you are, might be outside of the United States. But just reach out, find your tribe. The point of my show is to tell the stories of all the patients that I've met, and to prove that we're not alone on this journey. No matter what the condition, no matter what the disease, there's a lot of people that are out there looking for information. And I would just say, find your tribe, and we're waiting for you.
And you know what is really interesting that you mentioned, I do like to echo this as well often, is that I think a lot of the times people feel like they're alone in the journey. And, often people would look at me when I explain, what I'm going through with my life, because I unfortunately have 38 symptoms, and so I'm having to navigate my life through that. And they're all just looking at me like, oh my God, wow, how? And I always say to them, I'm not the only person going through this. There are so many people, and some of them have even more symptoms than I do. Like, I mean, with the combination of, like, fibromyalgia and rheumatoid arthritis and everything, there is like about, in total, about 50-ish odd symptoms. So I only experiencing, like, when I look at it, I'm like, well, I'm only experiencing 38 out of 50, whereas other people would be looking at it and thinking, oh my God, like, you're so bad. But, like, the reality is that there's so many of us going through the exact same experience, and it's important that, all these different forums and different people speaking out, because it helps people to understand that they're not alone in this journey and that there is actually a solution. Because I know for myself, after I got COVID, sorry, I've been disabled since 22 years old, right? But I mean, like, I got COVID about 3 years ago, and it just progressed my physical health to the next stage, right? After it had been in remission for about 6 years. And so I'm still actively having treatment, blah, 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 blah. But at that time, I just thought, this is it. I can't do anything anymore. Like, I was the worst that I'd ever been. And mind you, I've had several surgeries and felt, this was the worst that I've ever felt. And had it not been for me speaking to other people, going to different forums and stuff, and learning that this is a common experience for people, that made me feel less. Why me? That feeling that you get, the why me, all those existential crises that you go through. Yeah, it kind of helped silence that.
Right. I definitely went through that.
Oh, bless you. And this is the thing, is that we all go through that, and this is why it's so important for us to speak up about it.
That's right. Heal out loud. That's what we're doing in 2024. We're not scared of it anymore. We're not hiding from it. We're not ashamed of it. Most of us need healing. We don't even realize it or understand where to begin. The service that I provide within, as me personally, as my own brand, as a consultant. I just want to get you the education, get you the right resources. I'm not a doctor. I'm not a medical professional, but I am a patient who's been on this journey now for 7 years, figuring it out, making mistakes, saying, okay, that doesn't work. But understanding that the resources that I've developed over the last 7 years can help other people, and that's why I do what I do. I want to educate you. I want you to empower yourself to become your own advocate for your health and your healing journey, and that's what the Heal Out Loud show and the Heal Out Loud journey is about.
And you know what? We're going to leave it at that because that is a perfect place to end it. But everyone, thank you so much for joining us here today. Nicole, thank you so much for joining us. For anybody that is interested in Nicole's journey, as she has mentioned, she's got a few different platforms that she advocates from. They will all be in the description section. All God, now I've got all tongue twisted over there. All the links will be in the description section. Nicole, thank you again for joining us.
Thank you so much, Berta. It's been my pleasure. Take care.
Thank you. Take care, everyone. We look forward to seeing everybody next week, where we continue to explore medical cannabis across the pond.